You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at mothertobaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mother of four, and a teratogen information specialist. So what I do is I talk to people, patients, family members, healthcare providers, about exposures before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. And an exposure can be anything. So a medication, a vaccine, a chemical that you work with, getting your nails done or your hair done, or like we're going to talk about today, things in our environment. And we are very lucky to have a very special guest with us to talk about environmental exposures in pregnancy. Welcome, Rebecca Schmidt.
Hi, it's great to be here.
Thank you for being here. So can you tell us a little bit about your background?
Yeah, I'm Rebecca Schmidt, and I'm in the Department of Public Health Sciences and associated with the Mind Institute at UC Davis, University of California, Davis. I'm a molecular epidemiologist, which means that I'm an epidemiologist who uses molecular methods to try to understand reasons that we have certain conditions regarding health.
Awesome. So let's jump right in. Before we go any further, what are environmental exposures?
Yeah, so similar to what you just mentioned, we think of environmental exposures as anything you're exposed to that's non-genetic. So any factor that you're exposed to, especially in utero, we're talking about anything the mom is exposed to that might get to the baby, including things like stress and other factors that could also influence that in utero environment.
So talk to us a little bit about your work with environmental exposures.
Yeah, so I have been working in epidemiology for couple decades now, and so I've always been interested in things that are in an environment that we might be able to modify in order to have a more healthy pregnancy outcome. And so I have been studying, especially during pregnancy, because that's a period of rapid growth and development for that baby, but it's a short period where it's a little easier to kind of watch our behavior, and most moms are very motivated. I know I was when I was pregnant, to do the right thing, but that would include things that what you're exposed to in terms of your diet and medications, and environmental exposures might be a little bit harder to know what you're being exposed to. So it could be anything from like the plastics in your drinking cup, or just things floating in the air. So I feel like those are a little more stressful to moms because they aren't as aware of what they're being exposed to, and it can feel impossible to avoid all of the things that you hear about in the news.
Yes. Thank you for bringing that up. That feeling that it is absolutely impossible to stop doing everything. But like you said, especially in pregnancy, I too was super motivated to do my very best. And it's like, am I doing my best when there's things I don't know about or things I can't control? It's such a good point to bring up that we can't possibly avoid everything. But thinking about maybe things that should be on our minds. How can certain environmental exposures affect a pregnancy?
Yeah, so there are certain things that have been linked to outcomes in babies that are not ideal. So things like small birth weight, which is more of an indicator that it's impacting growth and development, and then downstream long-term outcomes of that child could be influenced. So there's certain things that we know are just not good for a developing baby. That includes things like heavy metals, like lead and mercury and other harmful metals like that. And for those kinds of things, we know safe levels and not so safe levels. But there's other exposures that are typically regarded as not healthy, but we don't know what levels are unsafe. So there are certain chemicals in plastics and other things where, they're just ubiquitous. They're everywhere. And so if you have a little bit of exposure, we don't really know fully what the consequences that are, especially during critical periods of development during pregnancy.
So when you think about things like plastics and smog, stuff like that, the idea isn't necessarily total avoidance, which might not be possible, but really reducing the amount of your exposure. Is that fair?
Yeah, that is definitely fair. There are times where in the United States, we do things a little differently than like in Europe, where they have to prove that things are safe before they're kind of put out there in the world. And in the United States, we put things out in the world and then we kind of let researchers work to establish whether they're safe or not. And so it's a little bit backwards in the sense that we're kind of always playing catch up. So there are things that we kind of find out after they're in our environment that maybe they're associated with outcomes that are not good, and then we work to kind of modify those. So one of those things is like BPA, bisphenol A, which was in plastics. And then if we know that it's been linked in many, many studies with adverse outcomes, then we can work for policy change or even just once moms know, if the manufacturers know moms are starting to avoid it, they'll work to change and use a different compound.
Yep.
The problem with that is we have to work and show whether that replacement compound is also safe, and that's often a problem because sometimes they're not, and it takes us a little while to catch up and with the research in order to inform moms so they can make those decisions. But then there's just so many chemicals and compounds that are in our environment, and it takes us a while to study all of them.
Yeah, and it takes interest and it takes funding too. There's so much of a balance of, I wish we had more information, or, we've come so far already, but it takes time, effort, interest, expertise, funding to do that. So just as a teeny tiny segue, thank you. And thank you to all the other folks out there like you doing the same work, doing similar work. Thank you for studying and trying to make it a little bit easier for us as parents, yourself included, to make these decisions.
Yeah, you're welcome. I mean, I started again, the reason I went this direction is because I wanted to be a mom someday. And even then I was not sure what I could and couldn't do, or what exposures were really not that great. And at that time, when I was a student, my biggest vice was caffeine. So I went and studied it. Right?
Have some.
So I wanted to make sure it was okay for me to have my cup of coffee in the morning. And turns out it probably is okay for one cup. But yeah, there's a lot of other factors that need to be considered. It's a very complicated picture. So, maybe you can have one cup if you're like me and you metabolize caffeine slowly, but maybe you can have 3 cups if you're someone else who can metabolize it really quickly. So there's other differences that just make it a complicated picture, which makes it even harder to give kind of blanket advice to mothers, which again makes mothers have to kind of do their own research to kind of see where they might be falling, and maybe just for the most important things to be out there in terms of information instead of flooding them with, we have these findings across many studies that are very conflicting. Well, then maybe we're not quite ready for a message to all moms on something until we really know. But for those things where we are seeing reasons for concerns, it's important for researchers to kind of get that out to the broader public and make it known, because I feel like if moms at least know, kind of are informed, they can feel empowered to kind of do something, what they can, to avoid those exposures, and sometimes it's hard to do, avoid it completely, but at least reduce their levels, or at that particular time in life where it might be more important for them and their baby.
So now that we are in fire season, and recently, of course, there have been fires. You live in California, but, the East Coast had some exposure from the wildfires happening in Canada. Speak to us about wildfire exposure in pregnancy.
Yeah, so as you said, I live in California, and, from the first year I got there, we moved there in 2008, and that happened to be a bad wildfire season. I wasn't pregnant anymore, but I did wonder, what is breathing this smoke doing to me and my kids? Right. And now in the more recent fires, when I was there for the 2017 Napa-Sonoma Tubbs fire, that was pretty big at that time. It's since been surpassed by many fires, but in terms of size and smoke concentrations across California. But one of the things that I was doing at the time was a research study with pregnant women, and we had lots of very concerned moms about what is this wildfire smoke doing to my baby as I'm pregnant. And we reassure them that there's the uterus protects their baby from a lot of things during a lot of exposures like that. But I looked in the literature, and we really didn't know a lot at the time. Yeah. So there were just a couple studies with some links to maybe potential birth outcomes that weren't ideal in relation to some previous wildfire that happened, but they were at a much smaller level. And now there's quite a few studies that have been done, including our own, that are looking at the impacts of wildfire exposure and the potential impacts on that developing baby, and looking at it in relation to birth outcomes. And so far, the evidence is showing that there does seem to be this association between wildfire exposure during pregnancy and lower birth weight in babies, and also preterm birth or shorter gestational age. And that is a little bit concerning because it does indicate that there might be some influences of the wildfire smoke on that developing baby in terms of their growth. And that also can lead to longer term child health outcomes that aren't ideal. So we are kind of looking into it more, and I think there's enough reason to be concerned that, we already knew that ambient air pollution or air pollution from traffic and other things were already linked to some of these same birth outcomes. And so there's enough reason to want moms to protect themselves from the smoke as much as they can by staying indoors and running air filters. If they have air conditioning units, run those, and that way it'll clean the air with good filters. That's always ideal. And then also you can buy air purifiers, but also there are less expensive ways to build clean air box filter fan using box fan and duct tape and air filters. And that also has been shown to be effective on cleaning the air in the room that you're in and where you spend the most time. And then if moms have to go outside, that they're advised to wear those N95 masks that we're all so familiar with after COVID. Yes. But it's important to put those on to block the very small particles from getting breathed in deep into the lungs, because that's where those really small particles actually get the farthest and deepest, and they cause the most inflammation and other biologic responses that might be the most concerning. So it's really important to protect her and her baby by doing what we know has been shown to kind of reduce their exposure to smoke, and even if we don't know all of the potential health outcomes down the road.
So I want to take a step back real quick to air purifiers, which are excellent and helpful, but honestly not accessible to everybody from a financial standpoint. And I know that there are ways, I actually just learned this very recently from you, that there are ways to create a box fan. Can you tell us a little bit more about how to DIY a box fan filter at home?
Yeah, so there are researchers at UC Davis and elsewhere that have designed and shown how to create your own air filter system using box fans and air filters that you can get in any hardware store, along with some duct tape. So you just build this like a box out of those filters and the box fan, that sucks air in, and as it goes through the filters, it cleans it, and that way you can, and then redisperses it into whatever room you're in. So again, it's pretty low cost, but it's shown in multiple studies now to be effective at cleaning the air. So it's another way, and it's also easier to replace those filters as they get dirty and used during the wildfires. And so we can recommend those. And so it's actually designed by Dr. Corsi at UC Davis. It's called the Corsi-Rosenthal Box air filter.
I love it. And Mom MacGyver challenge accepted. I don't live in California, but I live in Arizona, and I don't live in a high wildfire area, but they absolutely happen in the surrounding areas. And I'm going to try that out. Thank you. I'm going to go to YouTube and find out how to build me one of those and do that. And
they're good for other types of air pollution as well. And I know my husband has one in our garage because that's where his office is now.
Nice. Smart.
It works.
Very smart. Okay, so lots of good information here. Thank you. Before I let you go, what are some final things, a final thought that you would like to leave our listeners and viewers with?
Yeah, so being a mom is stressful enough already.
Amen. Amen.
But in general, I think if you follow your intuition and kind of use some common sense on what you're kind of avoid the things that you know aren't great for you any other time, especially during pregnancy. And then for those things where you're not sure, it's always good to ask your healthcare provider for more information on how concerned you really need to be before you go giving up things that you might want, like caffeine, or before you stress out too much about trying to avoid exposures that maybe aren't really as big of a deal as you think they might be. And just keep in mind that most of the time, even if you're exposed to something here or there along the way in pregnancy, those babies are pretty resilient when they're developing, and most outcomes are good after all.
It's a good reminder because it's super easy to stress and think that every little thing is going to be something huge. And, it's not that, you're not doing everything you can, but in a lot of cases, like you said, it turns out great.
Yeah, most of the time that baby is born healthy.
Rebecca, thank you again, and we hope to have you back on a future episode of the podcast to talk a little bit more.
Great. I would love to share what we find in the future.
And that's going to do it for this episode of the Mother to Baby podcast. As always, don't forget to subscribe to the podcast so you never miss a new episode, and you can always go back and listen and re-listen to older episodes as well. You can find us on iTunes, Spotify, Audible, or however you listen to your podcasts. And if you have an idea for the podcast, or if you want to be on the podcast, we want to hear from you. So feel free to email us at contactus@mothertobaby.org. And for your questions about exposures before and during pregnancy, while breastfeeding, if you have questions about adoption and exposures, Mother to Baby is here with answers. So you can reach us by phone at 866-626-6847. By text at 855-999-3525. There's the Mother to Baby website, which is mothertobaby.org. There, you can live chat with an information specialist. You can also find episodes of the podcast, our baby blogs, our many hundreds of fact sheets in English and Spanish, by the way, 100% free to you. And also, we have information sheets and information on how you can get involved in our pregnancy studies. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.